Hi, welcome to the Valley View. I'm Carol Simila.
I'm Kim Brosh.
We're Salem's only TV talk show, and we are here today with some very distinguished guests. We have Diane Lund, editor and publisher of the Lund Report, and Amanda Waldroupe, who is the legislative reporter for the Lund Report. The Lund Report is an only online publication which you can find at thelundreport.org. And it is a wonderful publication that will tell you everything you need to know about health care and health insurance. And that's really what we're here to talk about today. Health insurance, health care. What's the scam? Why is it that we can't get this problem solved in this country and in this state?
Right.
You're absolutely right. I've got
what
the answer.
Okay.
So what to do? Well, the Oregon Legislature. They're
Sure.
trying to do something.
Yeah, they are currently in the process of quote unquote transforming healthcare. The bill to do that is perhaps the most important bill that's moving through the legislature right now in regards to healthcare. And what the proposal is currently is to take all the managed care organizations in the state that provide physical health care, mental health care, dental health care, and create what they're calling coordinated care organizations that will take each of these different types of health care and coordinate them in such a way that, the hope is that it cuts down on costs, it'll create efficiencies, patients won't have to be in the healthcare system as long as, they may be currently. Like people with diabetes wouldn't be put on medications that may exacerbate their depression, for example, and have like these different providers speaking to each other about this one individual and understanding the person as a whole rather than the body and the mind.
And what's this bill called?
It doesn't have a name
It's the
yet.
exchange bill,
It's just
or?
Called the Transformation Bill.
The transformation bill.
What number is it?
3560. I believe.
House Bill
But
35.
there are a lot of House bills, and I don't want to be quoted as saying that.
But the transformation bill.
The Transformation Bill.
And is it still alive?
Yes, a stakeholder group of 40 people that included 11 legislators, consumer advocates, people involved with insurance, people involved in each of these different types of care, sat around the table Wednesday nights for 8 weeks and talked about what would it be like to transform care in Oregon. And they created a number of recommendations, and that was turned into the current bill. And the legislature appointed a joint committee on healthcare transformation 3 weeks ago, I believe. That's made up of senators and representatives, and they've been meeting for the last 3 weeks and discussing the bill, making amendments and changes to it, and hearing testimony from people involved.
So why all this sudden energy now around healthcare? Is it because Kitzhaber is the governor again, and he was the one who initiated the Oregon Health Plan, or you're the
Well, and
historian.
also, didn't the president say that we're supposed to come up with a health plan
Well,
in the state?
Well, I think that, Kitzhaber wants to make his mark again. He created the Oregon Health Plan, which started in 1994, and with, burgeoning deficit, and he's concerned in a growing population that needs care and access to care. He wants to help create something new, and he has great relationships with Donald Berwick, who runs the Centers for Medicare and Medicaid Services.
Oh, that's right, I've heard
and is being assured that when the legislature does come up with a final product, he'll be able to get the waivers necessary to implement this. And the transformation process is great, as Amanda described. However, it's fraught with issues as well, because we're talking about bringing entire healthcare systems together, and the dental plans and the mental health care plans and the physical health care plans. And so there's concern that some people will be left outside the door. For example, there's concern by counties what's going to happen to their mental health money, community mental health, dental organizations. So this process that Amanda described with the legislative committee is going to be meeting at least until early June. Nothing is anticipated to be finalized before then.
I think it's a huge task to sort of unbuild all these silos and all the territoriality that goes with that.
Absolutely, and you can see members of the Joint Committee struggling with that each Wednesday night. And even last night, to dovetail on what Diane said, they heard testimony from a number of providers and a number of people involved with each type of care saying, you may not see the costs that everyone is expecting to come out of this transformation bill. And, you know, provider after provider after provider came forward to say, you know, we don't want to be in this for one reason or another because it won't cut costs, or because we won't be able to provide care as well, or we won't be able to do our jobs as well. And so there's a lot of hesitation. And just knowing how this is pretty uncharted territory. There isn't, you know, a model for coordinated care organizations anywhere in the United States at a level that is, you know, as big as the state. You know, there are individual nonprofits that do this. There's, you know, Kaiser, like the organization Central City Concern in Portland has, you know, a model that coordinates care in their clinic for homeless individuals, but no one really knows what it's going to be like at such a scale and what it would actually look like and how it would actually work.
But I think this is going to, even after the legislature does complete its work, I think basically what we're talking about now is this is going to gradually unfold. It's intended, this new transformation is intended initially for the people who are dual eligible, about 60,000 Oregonians who receive Medicare and Medicaid services. Then it'll basically gradually move into the Medicaid population of 500 to 600,000. Then it'll move into the public employees, the state employees, and then it'll move into the school districts, and eventually up to 1 million people, which is just a huge market. So you can imagine all the forces that at play here.
Well, I know a little bit about the Oregon Health Plan because my son is on the Oregon Health Plan because he receives SSI. And I know that for dental you have to choose your provider, and for mental health you have to pick like one of two providers.
Sure.
And for your physical doctors, you have like Care Oregon or the Mid-Valley
IPA.
And so, if that's the model right now, can't that just be expanded to include everybody?
It could potentially, but you know, under this new system, you wouldn't be choosing all these different providers. You'd be going to one place, and they would help you make those choices. It would basically, again, be coordinated, so you wouldn't have to pick and choose individual.
Now, are you talking about the exchange?
No, the exchange is totally different. Okay. Amanda can speak to that.
I can kind of speak to it. Another major piece of legislation that is working its way through the legislature right now is Senate Bill 99, which would create an insurance exchange in Oregon, where all of the insurance carriers would be put into a pool, and people could pick what type of insurance coverage they want. And so this is in direct response to President Obama's Affordable Health Care Act. And as many people know, one of the important discussions about that was providing health insurance for everybody. That act will create some type of insurance exchange at the national level by 2015, but Oregon wants to get ahead of that by creating its own exchange. So the bill passed out of the Senate last week. It is now being considered in the House of Representatives, but many people, especially consumer advocates, are angered that a number of consumer provisions was taken out of the bill in order for it to pass out of committee. And what House Democrats are saying is that they want to put those consumer pieces back in and allow for negotiating power and allow consumers to have more of a say at the table. But the risk in that, I think, is that the House is evenly split this year for the first time in the legislature's history, with 30 Democrats and 30 Republicans. So it could be very possible that if there were negotiating power in the exchange, like things could lock up along partisan lines and the bill wouldn't pass.
And so they basically cross paths because the exchange bill went from the Senate to the House, and now and the transformation bill went from the House to the Senate. So
that's not case yet. The Joint Committee on Healthcare Transformation is still looking at the transformation bill. It hasn't gone to either floor yet for a vote.
It involves both senators and House members.
So is it going to? Do you think is it too late for anything to really happen with the transformation? Should we be more focused on the exchange bill?
No, I think it's very important that people continue to focus on both, because if either of them happen or if both of them happen, it's going to make huge changes to our healthcare system. And the transformation bill isn't dead. I mean, they're still talking about it, and they're still making amendments and changes to whatever the final bill is going to be. And there is a lot of pressure coming from the governor and from other organizations for a bill to get onto both floors for a vote this session, I believe.
That's great.
That's the schedule.
You're right.
Cool. And what I'm really excited about is that we can follow all of this on the Lund Report.
Correct. Exactly.
Because it's so hard to wade through
Sure.
the bills
Exactly.
themselves and look at the website for the legislature. It's just, it's a morass. And you've sorted it all out for us.
Thank you.
I'm going to start reading this.
Yeah.
I'm so excited
And
about
you can
it,
sign up,
actually.
and if you sign up on our site, there's no charge. It's free, and you'll receive our email alerts, which are coming
Oh,
out
yeah.
now twice a week, and they'll tell you what stories, they'll give you the headlines, and so you can go right to the stories you want to read.
Right, and this would make us knowledgeable enough to actually communicate with our legislators, so we
Absolutely.
can help them
Right.
decide.
And the Lund Report doesn't have any other motive other than to share information.
It's
I
not
mean,
biased.
we're not biased. We basically believe in telling the truth about what's going on and uncovering information about finances and government or regulation. And we basically feel that we're the voice for the public. We don't have any advertisements on our site. We don't have any sponsors. We're a nonprofit. We're supported by our readers who give us grassroots support and by local foundations.
Well, there's not much cost to having a website. It's like
Well, it's
$10
paying
a
our
month
writers.
or something.
We
Paying
need
the
to-
writers.
we
Okay,
need to
that's
pay our
right.
writers.
Yes, absolutely.
So that they
Okay.
can produce
Yeah,
quality work,
right,
because
that's
we
good.
believe it's important to have professional journalists.
And they do a lot of research. And this one article, I know it was written by your predecessor, but it was about health insurers make more and cover fewer people. And this is just one example of what the Lund Report has brought. And it was just amazing to me at how during this huge crash, the stock market, everything went belly up except for the insurance industry, who are, making
Oodles of dollars.
More
more than any nonprofit organization should have.
Yeah, and they're even, in this article, they're defending themselves that this money, this big profit that we have this year isn't from, ripping off people in insurance. It's just because we're making money in the stock market.
Right, and that money,
Which
many of us
means
argue,
what?
should
Yeah.
be used for healthcare, even if it is in investment money.
And we also follow the rate request increases by the insurance industry as well, and publish that information. So we want to basically be there for the public.
Right, so the facts are there, and we can just
Sure.
figure out what we think about
Sure.
that.
And then you can comment on articles, which we really want people to share their voices as well, share their opinions. And that's
Is there like a blog type thing?
It's
where
like
you
a
can
blog.
see other people's
Yeah.
sure.
comments?
You can
That's
see other
great.
people's and post your own,
Okay.
Yeah.
which is
That's
great.
And you
fine.
can be anonymous.
Exactly.
Right, that's great.
Exactly. We prefer people share their names, but
Uh-huh.
you can be anonymous, correct. We have over more than 13,000 people reading the Lund Report.
That's awesome.
Yeah, I'm sure the industry is watching it too.
They do
Yeah.
watch what we write.
What is Diane saying about us now?
Exactly.
Although it isn't just Diane, it's also
No,
Amanda.
It's mostly Diane.
Well,
Amanda, gets the information together probably.
no, we have a team of great writers, including Amanda and David Rosenfeld, who are our chief writers right now, and so reporters, and they're doing a really wonderful job in keeping people informed. That's what it's all about.
So how do you get the information? Do you attend the hearings? And that
I go to committee hearings almost every day at the legislature, and the hearings I most frequently cover are, the healthcare committees in the Senate and the House, the Ways and Means Committee, which basically writes the state's budget. I've been going to the transformation hearings, the Senate General Government hearings, and then there's a lot of public testimony about bills, and the legislators give public comment as well. But then I also have the time to do outside reporting and interviews with people who are involved with each bill that I write about.
And she also goes to the PEB and the OEB meetings,
I
Public
forgot to
Employees
say
and
that.
School District, which is a very, very important, dimension to cover considering the budget problems. So.
Right.
Right. And they're discussing this at their meetings now.
Absolutely,
Budget
and OEB just voted today on rate renewals, and the Public Employees Benefit Board is faced with a pretty gaping budget hole. I think it's $30 million, something pretty close to that. And and they came up with 3 budget cut scenarios of here's all the different things that we can take out of our plans and increase and come up with these savings. But rather than vote on one of them or even 2 of them, they moved all 3 of them forward, which is frankly is a cop-out, because what that does is instead of the board making